Happy Tuesday, everyone. I'm wanting to talk to you guys today about setting the proper schedule of eating, especially with the summertime. I find that for some folks, they have less of a family and personal schedule with just their children being not as involved with extracurricular activities, so they're home more, which is great. We all need a break from those things. Or when they're vacationing more, there's less of a schedule, of course, on vacation than we generally tend to have at home. And so with that idle time, a lot of folks will complain about their desire to graze more or eat to fill boredom or time rather than listening to our physical cues of hunger. So I just wanted to send out some tips and ideas of ways that you can combat some of that behavior. It's very important to make sure that you're setting a proper schedule of eating after bariatric surgery. As we all know, some folks that have had surgery don't always have the right cues to eat. And so it's more about eating on a schedule than eating based on what their body is telling them. And so one of the first tips that I always recommend to prevent grazing is to make that schedule. Normally what we recommend is eating that first meal within an hour or two of waking, preferably an hour, but if you had to stretch that out to 2 hours, that would be okay. And then from that point moving forward to try and eat about every 3 to 4 hours. Definitely not going more than 6 hours without eating. This is only going to set you up to be overly hungry, to have a drop in your blood sugar and to feel kind of crummy. So we want to make sure that we're setting that schedule of eating about every 4 hours in the day. So for most, that could mean breakfast, lunch, a mid-afternoon snack, and supper. Even for our patients who work the night shift, I always use this same rule of thumb because they're not living the 8 o'clock breakfast, noon lunch, 4 o'clock snack, and 7 or 8 o'clock supper. They're living a much different time schedule. So if we can just say within 2 hours of waking, have that first meal, and then every 3 to 4 hours from that point moving forward, making sure that you're having a meal or a snack. Then at the end of the day, before bed, we do want to create a 2-hour buffer of no eating before bedtime. You're about to enter into a very low activity level of sleep. And so you don't want to take in a large amount of calories just to sit and lay there with very minimal burn. So making sure you have that 2-hour buffer. It's also good for prevention of reflux, that your body can begin digesting and moving that food through your stomach before laying down in that position. So if you set up that time schedule, you're more likely to follow it and allow yourself a good break between eating episodes. And by doing this routinely, you can break that cycle of wanting to eat out of boredom, wanting to eat to fill the time, and just eating out of non-physical cues to hunger. So practice these tips, set up your schedule, even if it's putting the schedule in your phone with alarm reminders to just make it a more concrete behavior, I think can help tremendously during this summertime. Thanks for listening, and call us if you have any questions. Bye-bye.